amazing week, all the work that you're doing in subcommittee, coming on time, participating, compromising. Thank you so much for your work. We are going to start first with the withdrawal. Is there a motion? Is there a second? It's been moved and second. All those in favor say aye. Aye. Any opposition? Thank you very much. It's unanimous. We're going to start with House Bill 6 and House Bill 6. Lindsay?
This bill requires the Department of General Services to establish standards for state buildings to conserve energy and minimize adverse impacts on birds and minimize lighting as specified. State buildings constructed, substantially altered, or acquired shall meet the standards both to the extent practicable and within budgetary constraints. DGS must reduce lighting of existing state buildings, and the Secretary of General Services must adopt regulations to carry out the bill. There's a reprint of amendments to the bill in your packet, beginning on page 1, that clarify that the requirements of the bill do not apply to buildings leased by the state, and make a technical correction clarifying the innovation credit terminology. These were considered in Government Operations Subcommittee.
Delegate Carr.
Thank you, Madam Chair. There were a couple of issues that we had to clarify, one having to do with the lease. We discussed them in committee. The committee vote was, I think there were 2 negative votes. But I'll move the amendments.
Is there a second? Second. Is there a discussion on the amendments? Seeing no discussion on the bill as amended, is there a motion? There's a first and a second. Is there a discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition, please raise your hand. Can you have it? Let me show you have it. Okay.
I like birds.
Okay. All right. Michelle, you got it? Okay, wonderful. Is there a sponsor? Since it's favorable with amendment, we will allow sponsor. If you do not want to be a sponsor, will you kindly raise your hand? Okay. You're loud? Okay, you got it? Okay. Michelle, you have it? Can you please raise your hand again? Why don't we just say Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Alston, Delegate Hutchinson, and Delegate Kipke. And Riley. Thank you. All right? All right.
You don't like birds that much.
So we have next House Bill 63, and that is Lindsay.
This bill, as originally introduced, would rename the Certified Local Farm Enterprise Program to be the Certified Local Farm and Chesapeake Invasive Species Provider Program, expands the program's purpose to include preferences for the purchase of food made from specified invasive species and made conforming changes. There are amendments that begin on page 5 in your packet to alter the name of the program to be the Certified Local Farm and Fish Program, requires the Office for the Certified Local Farm and Fish Program to submit an annual consolidated report to MGA committees on program implementation and participation, and alters the effective date of the bill from October 1st to July 1st. These were considered in Government Operations Subcommittee.
Thank you, Lindsay. Delegate Kerr.
Thank you, Madam Chair. We adopted the amendment to change the name and the date. The vote in subcommittee was unanimous. I move the amendment.
Is there a second? Second. It's been moved in second. Any discussion on the amendments? Seeing none on the bill as amended. Is there a motion? May I have a second? It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Since it's favorable with amendment, who does not want to be on the bill as a co-sponsor? Raise your hand. Everyone wants to be on the bill. Yes. Yes.
tell the committee that Delegate Steve Johnson will be floor leader on this bill.
All right, Steve. Wonderful. Next, we have House Bill 124, and that is mandated reports revision. It is Lindsay.
This bill repeals specified statutory reporting requirements that are obsolete, duplicative, or unnecessary. It also consolidates, reschedules, and clarifies reporting requirements for the purposes of efficiency and practicality and makes technical and stylistic changes. There are amendments in your packet beginning on page 7. The First Amendment is just technical. The Second Amendment repeals the requirement that the Maryland Higher Education Commission compile, submit, and publish certain reports, as the Maryland Longitudinal Data Systems Center advises that the report duplicates an existing reporting requirement and instead adds the certain reporting language into another report that's already made by the center, but it retains MHEC's role in collecting the data from the institutions of higher education. The Third Amendment alters reporting dates for reports from the Maryland Commission on Climate Change, the Department of the Environment, the Bay Restoration Fund Advisory Committee, and the Office of Recycling, and moves an ongoing reporting requirement for the Department of the Environment from uncodified language into the code. The Fourth Amendment alters the dates for reporting certain information by the Maryland 911 Board. And the Fifth Amendment modifies the reporting requirement to allow the Maryland Legal Services Corporation to submit data on individuals covered by fiscal year rather than calendar year. These were considered in the Government Operations Subcommittee.
Delegate Kerr.
Thank you, Madam Chair. We adopted the amendments unanimously. There was very little discussion on the bill. Unanimous vote in subcommittee, and I move the amendments.
Is there a second? It's been moved and second. Any discussion on the amendments? Seeing none on the bill as amended. It's been moved and second. Any discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Does anyone not want to be on the bill? Can you please raise your hand? Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke, and Delegate Chisholm. Thank you very much. Thank you for your work. And for our new member, the work in this committee is done. We have the hearing, then we do, I would say, almost everything on subcommittee, where everyone gets to come, whether you're for the bill or against it. You're given an opportunity to participate. Then the members, with the guidance of the chairman, come to a compromise and the guidance of the lawyer for the committee. So everything here is vetted really well. And that is not the case, in some other places. But we do everything here by subcommittee. And then the next bill is House Bill 141. And that is actually Lindsay.
This bill renames the Commission on LGBTQ Affairs to be the Commission on LGBTQIA+ Affairs and alters the membership of the commission. There are amendments that begin on page 18 in your packet that make a clarifying change relating to the duties of the commission and expands the diversity category sought to be reflected in the membership of the commission. This was considered in the Government Operations Subcommittee. Delegate
Kerr.
Thank you, Madam Chair. There was some discussion on this bill. Essentially, what the amendments do is just add membership to the commission. I believe it passed on a party line vote out of subcommittee. Other than that, one of the amendments, we have an amendment that doesn't match the Senate, and so when the Senate bill comes over here, we will just amend it to match our bill and send it back to them.
Thank you.
All right, I move the amendments.
Is there a second? Is there discussion on the amendments? Delegate Bagno.
Religion, or is religious okay?
So this is relating to the diversity of the membership. So it would be, to the extent practicable, reflect the religious diversity of the state. If you were to take out the rest of that list, so it's fine.
Any other questions or concerns? Seeing none on the bill as amended, is there a motion? Is there a second? It's been moved in second. Any discussion on the bill as amended? All those in favor say aye. Aye. Any opposition? We have Delegate Kipke, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley. Okay. It's favorable with amendment. Does anyone want to be on the bill? Oh, actually, who does not want to be on the bill? That's a much easier. I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Johnson, and Delegate Kipke. All right, thank you very much. And just let me correct something. We, for our new member, Delegate Martinez, we do most of our work here in subcommittee. The other committees, they vet everything beautifully like we do, but a lot of other committees do not use subcommittees like we do. But they do, a lot of them do as well, and the bills are vetted very carefully. Okay? Thank you. Just to make sure that people know that the work that is done in the General Assembly is excellent by all 6 committees. Okay. So we have Delegate House Bill 234.
This bill authorizes the State Board of Chiropractic Examiners to deny a license to an applicant or take specified actions against a licensee, for instance, suspending or revoking a license, if the applicant or licensee fails to comply with a board order. The bill specifies that an order of the board may not be stayed pending judicial review and authorizes the board to appeal a decision that reverses or modifies its orders. If a license is suspended or revoked, the board may reinstate the license in accordance with the terms and conditions of the order of suspension or revocation or an order of reinstatement issued by the board. There are amendments on page 19 in your packet which authorize the board to grant a stay of enforcement of a board order in accordance with the Administrative Procedure Act. These were considered in the Health Occupation Subcommittee.
Yes.
The vote on the amendments was unanimous, as was the vote on the bill itself. So I would move, if there is no discussion, I would move the amendments.
Is there a second? Is there a discussion? Seeing none on the bill as amended, is there a motion? Is there a second? Is there a discussion on the bill as amended by any member? Seeing none, all those in favor say aye. Any opposition? Seeing none, since it's favorable with amendment, who does not want to be on the bill as a co-sponsor? Can you please raise your hand? All right. House Bill 238, Lindsay.
This bill has language that mirrors the language that I just described in House Bill 234, but for the massage therapists. So again, it allows the board to take action against an applicant or licensee for failing to comply with a board order, specifies that an order may not be stayed pending judicial review, authorizes the board to appeal, and authorizes the board to reinstate a license in accordance with the terms and conditions of an order or order of reinstatement. In addition, this bill also as originally introduced, specified that practice massage therapy means to engage professionally with or without compensation in massage therapy, repeals a requirement that the board file notice for publication for each revocation or suspension in the Maryland Register, and repeals a provision of law that would prohibit an individual from performing or offering to perform a massage on another person for compensation unless that individual is licensed or registered, and instead allows for a 6-month grace period for practice after expiration of a license or registration. There are amendments that begin on page 20 in your packet that strike that language from the bill that would have specified that practice massage therapy means to engage professionally with or without compensation, so that remains as it is under current law, and also has the same amendment as the last bill authorizing the board to grant a stay of enforcement of a board order in accordance with the Administrative Procedure Act. And these were considered in Health Occupation Subcommittee.
Delegate Rosenberg.
Madam Chair, on this bill, similar to the prior bill, thus unanimous on the amendments as well as on the bill itself. So I would move the amendments.
It's been moved in second. Any discussion on the amendments? Delegate Olston.
I just have a question. Did you say it authorizes the board to issue a stay or not issue a stay?
They have that authority.
Okay, under the administrative, so it's the same as the administrative procedure?
Yes, it authorizes them to offer to grant a stay in accordance with the Administrative Procedure Act.
Okay, thank you.
Any other questions? This is the place to ask the questions. Any other questions or concerns? On the bill as amended? Did we vote on the amendments? No, we did not. So is there, move the amendment, it's been second. Any discussion? Seeing none on the amendment, all those in favor say aye. Any opposition to the amendments? On the bill as amended, is there a motion? It's been moved in second. Any discussion on the bill? Seeing none, all those in favor say aye. Any opposition? Seeing none, because the bill is favorable with amendment, who does not want to be on this bill? House Bill 245. Lindsay.
As originally introduced, this bill would have required the Office of State Procurement in DGS to maintain a list of the units required to report on their compliance with the Minority Business Enterprise Program to the Governor's Office of Small Minority and Women Business Affairs, which I will refer to as GOSBA. There are amendments on page 24 in your packet that alter a requirement for receipt of certain MBE program reports by the Joint Committee on Fair Practices and State Personnel Oversight. And instead of requiring Office of State Procurement to maintain a list of units, instead requires GOSBA to include an attestation as to the accuracy of the list that's included in their annual aggregate report on the MBE compliance, and also conduct an audit of that list every 3 years. These were considered in the Government Operations Subcommittee.
Delegate Kerr.
Thank you, Madam Chair. Aside from some questions about the sponsor, there were really, there was not much discussion on this bill. The amendments passed unanimously, as did the bill. Move the amendments.
It's been moved in second. Any discussion on the amendments? Seeing none on the bill as amended, is there a motion? Is there a second? Is there discussion? All those in favor say aye. Any opposition? Seeing none, because the bill is favorable with amendment, is there someone who does not want to be on this bill? Thank you. House Bill 291, Lisa.
This bill alters the qualifications to become a licensed clinical alcohol and drug counselor or a licensed graduate alcohol and drug counselor. The bill specifies that the required master's or doctoral degree must be in a professional counseling field rather than a health and human services counseling field, and that the required degree must be from an accredited educational institution rather than a regionally accredited educational institution. The bill also repeals a second educational pathway for licensure and removes from statute-specific coursework requirements. It was considered in the Health, Occupations, and Long-Term Care Subcommittee, and there were no amendments.
Delegate Rosenberg.
This was a unanimous vote in the subcommittee, and I would also add that for the cross-file was favorable report and then a 45-0 vote on the Senate floor. So that bill is, if we were to pass this bill out without any changes, the work is done because the bills would be identical. So I would move the bill.
Is there a second? Any discussion on the bill? All those in favor say aye. Any opposition to the bill? Seeing none, thank you very much. It is favorable, so we cannot allow co-sponsorship. House Bill 302, Aaron.
This bill establishes a Rare Disease Advisory Council to enhance research and provide policy recommendations on matters related to individuals living with rare diseases in the state. There are amendments on page 28 of your packet that were adopted in the Public Health and Minority Health Disparities Subcommittee. They add to the council the chair of the State Advisory Council on Hereditary and Congenital Disorders and a representative of an organization that provides care management for individuals enrolled in the state's Rare and Expensive Care Management Program. They also strike the requirement that the council make recommendations related to newborn screening.
Vice Chair Kelly.
This bill actually is being handled on the floor by Delegate Hill, so I will let her explain the amendments and the bill and answer any questions.
Delegate Hill.
Thank you, Madam Chair.
My pleasure.
Madam Vice Chair Emeritus. So, under this legislation, we are creating another advisory council, the Rare Disease Advisory Council. Already under MDH, there's the Office of Genetics Advisory Councils and Committees, and they include the Advisory Council to the Maryland Early Hearing Detection and Intensive Program, and the State Advisory Council on Hereditary and Congenital Disorders. These amendments are really responsive to some favorable with amendment testimony that received, and making sure that there's no overlap between the duties of the existing councils and this new one.
Move the amendments.
Move the amendments.
Second.
Great job. Is there a discussion on the amendments? Seeing none on the amendments, all those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended, is there a motion? It's been moved and second. Any discussion from anyone? Seeing none, all those in favor say aye. Aye. Any opposition? Is there it's favorable with amendments, so is there someone who does not want to be on this bill as a co-sponsor? Please raise your hand. Thank you. And thank you for your work on this. And Delegate Hill, I look forward to seeing you on the floor.
She's smart. She can handle it.
Actually, for our new member, when we have, if I may just take a minute, when we have a bill on the floor that comes out of the committee that you sit, it would not be prudent to get up against that bill from that committee, because this is like whatever team you like. It's a team, and even though you have not voted for it, it reflects all of us. So we shouldn't do that, okay? You're on third reader, you're welcome to vote however you want on the bill, but do not speak against any bill that comes from this floor. Respectfully, I would ask, because it reflects on all of us, okay? So we have House Bill 340, and that is Aaron.
This bill alters the definition of Health and Human Services Referral System to mean a coordinated system for health and human service resources accessible to all state residents through 211 and other designated technology systems. The bill also repeals the requirements that MDH evaluate the performance of each 211 Maryland call center and make recommendations to 211 Maryland regarding the quality of service provided by call centers. There are no amendments, and it was in the Public Health and Minority Health Disparities Subcommittee.
Vice Chair Kelly.
Thank you. Thank you, Madam Chairman. This bill is actually being defended on the floor by Delegate Lewis, so I will let her explain it and answer any questions.
Thank you, Madam Chair Emeritus, colleagues. So House Bill 340 is really a pretty simple technical change to existing statute regarding the 211 call program. What the bill does is it transfers, it clarifies the relationship between, the oversight relationship between the Maryland Department of Health and the 211 Board of Directors, which is something we need to do. And I think it's a common sense technical fix that you can feel good getting behind. I hope that's enough. I'd like to move the bill, Madam Chair.
It has been moved and second. Beautifully explained. Any discussion? Seeing none on the bill, all those in favor say aye. Aye. Any opposition? Is there someone who does not want to be, oh, it's favorable, you cannot have co-sponsorship. Thank you very much. House Bill 351, Lindsay.
This bill authorizes a licensed direct entry midwife to assume or continue to take responsibility for a patient if the patient has had a single previous cesarean section that resulted in a confirmed low transverse incision and was performed at least 18 months before the expected date of birth for the current pregnancy. If a patient meets these criteria, then a licensed direct entry midwife must obtain additional informed consent from the patient as specified and consult with an obstetrician, certified nurse midwife, or licensed certified midwife and document the consultation as specified. The bill also requires the Board of Nursing, in consultation with the Maryland Institute for Emergency Medical Services Systems and other specified stakeholders, to develop a standard plan out-of-hospital birth transport protocol for patients who meet these criteria. The very last page in your packet, page 30, has an amendment that requires the patient-informed consent to include information about alternatives to home birth after cesarean section. This was an amendment that was offered in the bill hearing on Wednesday by the Board of Nursing. They also offered two additional amendments, which were reorganizational in nature, and they've emailed me this morning to say they withdraw those 2 amendments. So this last third amendment is the only one that the Board of Nursing continues to offer on this bill, and this bill is not considered in subcommittee.
Delegate Rosenberg. Actually, no, it's Collison. Vice Chair Collison.
Thank you, Madam Chair, and thank you for committee. This is a bill that I think we've talked about over the years, and it really comes down to each person having the right to make choices relative to their own health care, and in this case, pregnancy and delivery. You received, I believe, either last night or early this morning, some documentation from the Maryland Hospital Association. I looked through it to see if there was anything alarming in terms of risk. We've already stated that there is risk. One of the things that the information said was that in cases of VBACs, so vaginal birth after cesarean, that there are more instances of transfers from the home to the hospital. So out of 100, there might be, I think the number was 37. But the transfer ultimately, what it doesn't say, but I think it would say if those were negative outcomes. It doesn't say whether the outcomes were negative or positive, which leads me to believe the outcomes were positive. So the midwife did the right thing. And but what the article also said was those women having choosing an at-home birth, VBAC, actually have more vaginal births than if they had gone to the hospital and asked for a VBAC. So again, this is knowing the information. The consent document is very strong. I was encouraged to see the Secretary of Health sign a letter that says people can do what they want to do as long as they are informed of the risk and that they sign the consent form. The consent form was developed, all of the aspects of the consent form in collaboration with physicians and the Hospitals Association. So we've done all we can to make this as safe as we can for women who make that choice to have their birth at home under some very stringent requirements and guardrails. As I said in my testimony, we believe that with the guardrails in place, the risk to the woman is less than 1% of a negative outcome. So we believe that this is good policy in which it gives the individuals the authority to make these kinds of decisions. And I would move the amendment.
Second.
Before we do that, Delegate Kipke's taking this to the floor.
yes.
So I wanted to give him an opportunity to talk a little bit about the bill. You know, the way the amazing Vice Chair just did.
The only thing that I'll add is I think it makes it safer for people because as we've heard in testimony over the years, people are doing this anyway. And they're very committed to doing it anyway, and they're not going to change their mind about that. And so if you're now allowing it under a broader group of people will be allowed to do this, not everybody, because as it was said in the bill, it's restricted to individuals who had a cesarean more than 18 months ago, and they could have only had one cesarean as well. So not everybody will be eligible for this. But for those that do, if there is an issue, there's protocols in place where they will be able to come to the hospital with the mother and not have to sort of hide what's been going on. In addition to that, mothers who have pregnancy at home under current law, those mothers sometimes transfer too. So I can tell you in our experience with our second child, the midwife said if the blood oxygen level doesn't increase, we may have to transfer it to the hospital. And she helped my wife do some different things with her body, and everything went well from that point forward. So they're very judicious in how this happens, and you have to be the right candidate to do it at all, which is already in the guidelines for the practice. Additionally, it's been brought up in the hearing about malpractice or liability insurance, and that's already disclosed in the law. The law requires that to be disclosed to the patient. It was brought up that in Virginia they're required to do that, and we should do that too. Well, we already do it. They should have looked at the law when they brought that up as a guideline or as a concern. So, I appreciate the chairs moving this bill finally after years. We took into account amendments last year that the pediatricians and the OBs offered, and I think it's a very cautious and responsible step forward. Thank you.
Thank you, and I want to thank, the chairman for your work on the bill, and I want to thank you as well, Delegate Kipke, and everyone that has, helped with the discussion as well. I know it has not passed in like 4 years straight, but we're going to do it because it's actually, they're doing it anyway, and it creates some safety as well, and they do sign a consent form. And that's important to note as well. So I know it's been moved. Is there a second? The amendments. Yeah. Is there any discussion on the amendments? Oh, discussion on the amendments? I can discuss on the bill. Okay. All those in favor say aye. Aye. Any opposition to the amendments? On the bill as amended, is there a motion? Second. Is there discussion?
I just wanted to add, to sort of follow up on what Delegate Kipke was saying, that, and again, I had a birth center birth that ended up in a transfer to a hospital, and I had a hospital birth for my second. But I always had a tremendous fear of a C-section for work-related reasons. The recovery from a C-section can be really problematic. There are many legitimate reasons why people try their best to minimize the chances of a C-section, and I want to respect people's individual rights to make their individual choices. For me, my fear of a C-section had to do with the fact that I had to be back to work within 2 weeks, and I knew if I had a C-section, I was going to lose my job. Everyone has their own individual reasons, and the reason I support this bill, and I thank Delegate Cullison for bringing this bill, is just that it acknowledges that as we're building our families, everyone's life and situations are different. So I am very thankful that we're able to move this bill.
Delegate Bagnall.
Thank you, Madam Chair, and thank you for your work on this bill. And I just wanted to also offer my appreciation. Last night I was on a call, and thank you to the chair for organizing the call. For those who don't know, our last birthing center in the state of Maryland closed in January. So that was our last subacute setting for labor and birth, which means that when we're talking about choice, this is really important because obviously people have their labor and delivery plans, and they make them months in advance. And being able to have that choice and have that informed consent, and to Delegate Kipke's point, do it in the safest manner possible is really important. So thank you all. Thank you for the work that you've done on this bill.
Delegate Hill.
Thank you, Madam Chair. I would like to congratulate Delegate Cullison. I think the amendments make this a better bill, and I'm going to support this legislation because I think, for me, consistency is important. And I am arguing with other bills for the importance of autonomy in healthcare decisions for women with respect to reproductive health, and for all the reasons that Delegate Kipke said. I think that for consistency, it is best that we make it safe. It is best that we recognize the autonomy of the mother and the caregiver, and we allow them to make the decisions regardless of what their circumstances are, that they can consider all those circumstances and make the best decision that they can for themselves and their families.
Delegate Hutchinson.
Thank you, Madam Chair. I just wanted to share with the group, last evening I had dinner with a chief medical officer that the chairwoman I know quite well, and she was adamantly against this practice being done. I am supportive of it. I will certainly vote in favor of it because I think it does provide a choice. The consent is strong. And as Chairwoman said, as we closed out the session, that on the Eastern Shore, there's just not a lot of hospitals that you can get to very quickly. I'll also share, though, I won't sponsor the bill, as I have a personal experience with my child being born, and through a C-section, just a potentially very horrible outcome, and that's the whole thing brought back some interesting memories to me about it, but I'm very supportive of it, and just want you to know that. Thank you.
Thank you. Delegate Shalega.
Thank you, Madam Chair. I just wanted to say thank you. Thank you for moving this bill. Thanks for getting this out while we still have the vice chair, the emeritus, I guess, as Delegate Hill said, but I'm grateful that we're doing this. Thank you.
Thank you. Any other comments, Delegate Woods?
Yes, I also want to thank Delegate Collison for this. And just as a point of record, I had 2 C-sections. I was made to believe I didn't have a choice when it came to my second birth. And I preferred a vaginal delivery, but I was made to believe that I did not have a choice. And so I thank you for this work.
Any other comments? I want to thank everyone for your very respectful and honest discussion. Thank you for sharing your experiences. And with that being said, all those in favor say aye. Aye. Any opposition? Actually, who does not want to be on the bill? Oh, it's favor with amendment. Okay, so we have Delegate Kaiser and Delegate Hutchinson. Thank you so much for the discussion. I appreciate it. Next, we have House Bill 376. Lisa.
This bill prohibits carriers that provide coverage for a diagnostic breast exam or supplemental breast exam from imposing a copayment, coinsurance, or deductible requirement for such examinations. The bill includes language intended to ensure that the cost-sharing prohibition does not conflict with federal requirements related to health savings account qualified high-deductible health plans, and it was considered in the Health Insurance and Pharmaceutical Subcommittee, and there were no amendments.
Delegate Collison.
Thank you, Madam Chair.
Vice Chair Collison. I will get used to it.
I'm not sure I will, but that,
I will.
That's another story. But thank you. Actually, this bill is going to be presented by Delegate Bandari, but I didn't tell him that until this morning, so he's not prepared to present it.
He said he can try.
You ready? Okay, Delegate Bandari.
Yeah, this is a simple bill. And,
we never say that around here.
I mean, then perfect bill, I would say. There is no letter A in the status. There is no amendment, right? And, we always talk about the problem. What is the issues that the bill is trying to fix? That our state is currently facing an increase in patients presenting with later stage cancers, third stage, fourth stage cancer. So it will help. It aims to increase the access to care for all Maryland residents, as breast cancer has a significant personal and economic burden. And this bill is Lindsay, right? Lisa explained. It would prohibit insurer, nonprofit health service plan, and health maintenance organization from requiring co-payments, co-insurance, or deductible for breast cancer diagnostic and supplemental examination. And this will help our vulnerable residents, and it will encourage folks to have a screening. Then it won't be a lot of burden on our healthcare system too in the long run. I'm dealing with this issues even in my family, so it's win-win for everyone.
Wonderful. So with that being said, is there a motion on the bill? It's been moved in second. Any discussion? Seeing none. Oh, Delegate Hill.
Madam Chair, it's not it's on the bill, but it's not, it's just that what came out in the testimony is, of course, that this bill helps women with insurance, and women without insurance are still having to pay, even for their screening mammograms. And the radiology groups and centers will have an October breast month where they may give discounts, but I wanted to bring up to this committee that if it is the sense of the committee and it pleases the chair, that you might consider writing a letter to the radiology groups in the hospital, asking them what they're going to do to step up in offering deeply discounted or free screening and diagnostic mammograms to the uninsured. I just wanted to raise that.
It's a good idea. It's a good idea. If you want to draft it and give it to my staff. Okay? Thank you. Any other discussion? All right, all those in favor say aye. Aye. Any opposition? Seeing none, thank you very much for the healthy discussion. Thank you, Delegate Vice Chair Collison, for your work. And Delegate Bandari, you did great. The last bill for today is House Bill 615. Lisa.
House Bill 615 extends by 1 year the reporting and termination dates for the work group on Black, Latino, Asian American, Pacific Islander, and other underrepresented behavioral health professionals. It was considered in the Health Occupations and Long-Term Care Subcommittee, and there are no amendments.
Rosenberg.
There are no amendments and no opposition. It was unanimous. What is noteworthy about this bill is that Delegate Woods will be floor leader. I did not inform her of that until just before the committee started, so that's why we just signaled each other that I will be doing this presentation, but she will be responsible on the floor.
Okay.
So move favorable.
Is there a second? It's been moved and second. Any discussion? All those in favor say aye. Aye. Any opposition? It's unanimous. I want to take a minute to say, in the past, this committee, we have, only allowed the chairmen of the subcommittee to take bills to the floor. I am trying something new and, just make us look good out there, and remember that less is best, okay? Listen to the question and just give the answer. And even if you want to give more to show that you know it or describe the bill, don't do it. Just get less is best, okay? And you can always yield to the chairman for help. And I want to thank you for a very, productive week as well. And if you could stay 1 minute after we go off, that would be wonderful, okay? Thank you very much for everyone watching at home. We're done? Okay, thank you. What is it? Okay, we're ready?